Hi everyone. Welcome to this 1.5 hour session called Introduction to Misinformation. My name is Lorna Dawson. I am the Public Health and Engagement Librarian at Buzz Health and Wellbeing Service, which is part of Greater Manchester Mental Health. And I'm joined by Caroline College, who is the Library Assistant at the Prestwich Library, the Curve Library at Greater Manchester Mental Health. So the session today is part of the Better Information programme, and the Better Information programme aims to empower people to make more informed decisions about their health through health literacy and health information training. So we do this by recruiting knowledge champions. So the aim of the Better Information programme is to establish a knowledge champion role in health and social care organisations who can share their learning and advocate for better health information. So by the end of this training, you will be knowledge champions, and it's not too kind of onerous a task. It'll probably be things that you'd already do as a result of the training anyway. So we ask you to use your learning from the session today in your own practice, to share your learning from the session today with others. So this could be with colleagues, it could be with friends and family. And we also ask you to stay in touch with the Library and Knowledge Service for more support. So don't feel like this is the only time that you can talk to us about misinformation. You're kind of like welcome to contact us and ask us questions if there was something that you found really interesting and wanted to find out more about, or if something popped up and you wanted a bit of advice. And we're going to be giving our contact details at the end of the session. So the aim of today's session is to learn about different sources of health information and how to tell if it's any good. And the objectives are, by the end of this session, you should be knowledgeable about the range of health information available, knowledgeable about the impact of low quality health information, skilled in being able to check the quality of health information. So we'll spend a lot of kind of this session looking at pieces of coronavirus information and checking whether they're any good or not. And you should also be aware of a range of evidence-based sources of health information. So we give our kind of top 5 go-to sites at the end. So does anybody have any questions so far?
I think Simon's just typing a message there.
Cool. Cool, no, that looks good. Okay, cool. So we're going to get into kind of like a first icebreaker activity, just to kind of get used to using the chat. And we're going to think about sources of health information. And what I'd like you to do is kind of cast your mind back to the last time that you looked for health information. And I'd like you to have a think about where you looked for that information. So kind of cast your mind back to a recent time when you had to look for health information. Have a think about where you went to look for that information, and then share where you got it from in the chat.
Shelley's typing there, and I think Megan is. So, oh, Google, Dr. Google.
Yeah.
Making an appearance first. That was from Shelley, and I think Megan's typing as well, I think. NHS website, yeah. That's from Maxine. Yeah, Megan's saying Google first and then look for a website that looked like a UK website. Okay, it's quite interesting.
Yeah, so region specific.
Yeah. I think Simon's typing there. Yeah, Shelley's saying patient online, and Simon's saying workings on fall prevention, so the NHS and nice guidance.
Cool, that's great. So thank you for sharing those. I think Google and the NHS website come up quite often, and I think we're kind of starting to make the point that there are lots of different places that you can look for kind of health information. We mentioned kind of a lot of online sources. So Caroline and I kind of put ourselves together, and we had a go at this too. And we tried to think of all the different places that you could get kind of health information from. And so the first one is the internet, which was like the first one that was mentioned. We've got the NHS website. I'm kind of looking, NICE guidelines is on there. So NICE website is at the top of that second column. And we included other things as well, like friends and family sometimes come up. Or you can go to your local public library for kind of health books. I deal a lot with kind of like journal articles, peer-reviewed or non-peer-reviewed, but people also get their kind of health information from things like Facebook, Twitter and Instagram. So yeah, the point we're trying to make is that we get health information from a lot of different places now. Now, I'd like you to have a think about all those different places that you can get health information from, not just the ones that you came up with, but the ones that we came up with as well. And I've got another question. And my next question is, thinking about all the different places that you can get health information, are they all reliable? And if you think yes, they are, keep your hand down. But if you think no, they're not, put your hand up. Cool. So I think we've got the majority of people saying no, they're not all reliable. And I think all the ones that you guys mentioned would be reliable sources, but not all the ones that me and Caroline came up with would be. And that's kind of why we're here, to kind of work out what's reliable and what's not. So if you could put your hands down, that would be great. So before we get into actually checking some health information, we're going to look at the impact of health information, and particularly the impact of low quality health information. So you should be able to see a screenshot of a news article on your screen. And this article is from the US Health Times. And it says, a new study finds marijuana is 100 times less toxic than alcohol and safer than tobacco. And this was the most shared health article in 2018. And it was shared over 1 million times. And it sounds kind of pretty convincing because it's based on a study. And the study did actually find that marijuana is kind of less toxic than alcohol. But we need to kind of dig a little deeper into this story, because toxicity is just one way to characterize harm. There are lots of other harmful effects of cannabis, like risk, addiction and psychosis. And if we look at kind of like the research itself, those conclusions are drawn from 2 self-reported studies. So we wouldn't consider that particularly high quality evidence. Whereas there are systematic reviews, so that studies of thousands of studies that show there are links between cannabis use and the risk of psychosis. So this headline is encouraging people to use a drug that increases their risk of psychosis, but that's not mentioned in the article. So as I said, that article was kind of based on some sort of research. So what's happening for that potentially kind of high quality research to become this kind of inaccurate misinformation? So what's happened is that the research has been mediated, interpreted and summarised by third parties, so by like the journalists who are writing that story. in favour of things like sensationalised headlines and clickbait. So that headline, cannabis is 100 times less toxic than alcohol, is a sensationalist headline that really grabs you in. And it is arguably clickbait. So that's where an article isn't necessarily there to inform you. It's just got a really catchy title so that you'll click on it and maybe keep clicking on links in that article. So it's about how many clicks you do as opposed to whether you read it even or whether it informs you. So the scientific findings are misinterpreted, and this can be kind of like confusing and contradictory. An example of this is I recently saw 2 news articles on whether you should drink caffeine during pregnancy, and they were based on the same research paper, but one said that it was fine to drink caffeine during pregnancy and one said that it wasn't, and they were based on the same paper. So that's really confusing, and I wouldn't know kind of what to do. And sometimes it can be politically motivated, so it's twisted to show a political bias or agenda. And what this leads to is things like confusion. So as I mentioned before, kind of should you drink caffeine during pregnancy? I might still not know. It leads to poor decisions and illness, so people potentially taking advice that causes them harm. And even kind of a danger to lives. So some people have even been hospitalised because they followed advice kind of on the internet that was incorrect. So this is an example of when people have seen that kind of apricot kernels might combat cancer, so people have eaten them, but actually eating them in large quantities causes cyanide poisoning. So people have been admitted to hospital for cyanide poisoning because of advice they followed kind of on the internet. It causes people taking up appointments that they might not need to if they had followed kind of like accurate advice, and it causes a preventable cost to the NHS. Does anybody have any questions at this point? Feel free to put your hand up. Or I think we're okay. I'll keep going, but feel free to kind of like ask them at any point. So how do we tell if this health information is any good? It's really difficult to tell what's low and what's high quality. So now I'm going to share a couple of different checklists with you that you can use to kind of check the quality of health information, particularly in the media and on social media. So the first checklist is called the CRAP test. It was developed by Miriam University Library in Chicago, and it's a really easy acronym to follow. So CRAP stands for current, relevant, authoritative, accurate, and purpose. And I've just got some extra questions to kind of expand on those words. So when you think about current, think about when it was published, but also if the references are current. So I was reading something and it said, oh, recent research says this, but it was quoting something that was from about 1990. So I was like, I'm not sure if that's recent. With relevant, think about, does it relate to your topic? Does it relate to you? Is it aimed at the right audience? With the author, always consider kind of who the author is and what their credentials are. Are they kind of a medical professional with appropriate qualifications, or are they a journalist with kind of like, you know, qualifications in the field of health? With accuracy, look at kind of where the information has originally come from. Is it using kind of statistics or quoting another newspaper article, or is it kind of quoting the World Health Organization? And is it quoting that organisation accurately? And with purpose, think about why the information was actually kind of written in the first place. Is it to inform you, or is it to kind of get you to buy something perhaps, or push a particular political agenda? So now what I'm going to do is I'm going to look at a piece of kind of coronavirus information that was in the news and apply the crap test to it. So this is a screenshot of an article from the CNBC website. So that's the Consumer News and Business Channel. And they reported that asymptomatic spread of coronavirus is very rare, according to the World Health Organization. So let's apply the crap test to it. So is it current? This article was published in June 2020, so maybe about 9 months ago now. So it's not massively old, but kind of our understanding of coronavirus is changing on a daily or weekly basis. So with information about coronavirus, we want the most up-to-date information as possible. So something that's 9 months old is probably not kind of like current in terms of kind of our understanding of the virus. So I'd say it's not current at the moment, or potentially not reliable. With relevant, information about coronavirus is kind of highly relevant to the whole population at the moment, particularly as we might be kind of coming out of lockdown soon. So there's more chance of kind of coming into contact with other people and more chance of asymptomatic spread of the virus happening. So this could be kind of highly relevant. Is it authoritative? So this article is written by William Foyer and Noah Higginsdon, and they've got their Twitter handles underneath their names. So I had a look at them. I did a bit of digging, and I found that they're journalists. They're very good journalists. They've won kind of like awards in journalism, but they're not kind of like scientific experts or medical professionals, and they don't even specialise in reporting on health in the media. So Foyer specialises on Asian markets. So I'd be wary about what they're saying. Is it accurate? So there's a really great website called Health Feedback, which we'll be sharing later in the training. And they look at kind of news articles and Facebook claims about lots of different kind of like information, but a lot about coronavirus at the moment. And they get them checked by kind of medical professionals and experts, and they check the credibility of the claims. And they said that this article is very misleading. It's actually estimated that 40% of COVID-19 transmission occurs before people show symptoms. And that kind of statistic is from the CDC, the Centre for Disease Control and Prevention. The interesting thing about this article is that a spokesperson from the World Health Organization did actually say that asymptomatic spread of coronavirus is very rare, but it's misleading because asymptomatic, according to the World Health Organization, means absolutely no symptoms, and they were looking at a very small number of cases, whereas asymptomatic to kind of like the general public and people on the street is kind of like, it might be a few symptoms, it might be feeling unwell. So those definitions are different. There's a very subtle difference, but there is a difference. And the CNBC kind of snapped that quote up and published it and shared this. So sometimes it's very subtle how information is used inaccurately. And finally, what's the purpose? So CNBC is a business news site, and the economy has taken kind of like a hit because of the pandemic. So there's a possibility that they want to get people kind of back on the streets, back into shops, buying things to boost the economy again. So there's possibly kind of like an ulterior motive there. Okay. Before I set you on an exercise, I'll just ask if anybody has any questions about that.
Simon's typing there. Yes, Simon's just saying it just makes you think of checking more into what you're actually reading. I think it's a really good point.
Yeah. And that brings us next.
Years, is it?
No, and that's it. Yeah, it's a really interesting one because a spokesperson from the World Health Organization actually said that, and then they had to kind of retract their statement. But that's not reported on in that story. Cool. So now it's over to you guys. So I sent round a PDF earlier on with articles to read. And now we're going to have a look at Article 1. So it's the article from the New York Post that says COVID-19 mutation may be evolving to bypass mask wearing and hand washing. So what I'd like you to do is have a read through that article. If you don't have the PDF to hand, Caroline's going to post a link in the chat so you can always get it up on your web browser. Thank you. So I'd like you to have a read of that article and have a think about those crap test questions. So think about kind of when was it published, is it current, is it relevant, is it authoritative, accurate, and what's the purpose? So I'm going to give you 10 minutes for this. So if you haven't read it already, that's absolutely fine. So it's pretty much 10:30. So I'll give you 10 minutes to have a read of the article and have a think about those crap test questions, and then we'll come back at 22, so 10:40, and share responses in the chat. And me and Caroline will be kind of on and available throughout those 10 minutes if you kind of have any questions or want to kind of chat about anything else. So I'll give you 10 minutes from now to have a look through that article and then have a think about those crap test questions. And those crap test questions are on the page after the article, if that helps in the PDF. So this article said that COVID-19 mutation may be evolving to bypass mask wearing and hand washing. And it talks about a new COVID-19 mutation that appears to be kind of even more contagious, and it might kind of come to defeat the measures that we've got in place at the moment to protect ourselves from the spread of the virus. So let's apply the crap test to it. So first of all, is it current? Kind of when was it published? Do we think it's current? And if you could share responses in the chat, that would be great.
Megan's saying September 2020.
Yeah.
And Shelley says no, if it's COVID related. Maxine, it was published in September 2020, so not really current. Simon's saying he initially thought yes, but now he doesn't think it is current. And Lauren was saying corona information is moving so fast, it's probably not current.
Yeah, cool. So those are kind of great responses. So September was only 6 months ago, so it's not actually kind of that long ago. But yeah, in terms of coronavirus information and our understanding of it, 6 months is a long time ago, so it's probably not that current. So I think kind of like we're right there. How about relevant? Does it relate to us?
Simon's saying yes, it does relate. Megan, the same yes at the moment. Yeah, Lauren's agreeing, she's saying yes. Shelley says yes. COVID relates to everything, which is a good point. And Maxine says yes.
Yeah. So I think, yeah, for the most part, it's kind of relevant. Some people say that because it's based in Texas, maybe it's not, but kind of we're definitely getting strains or different strains from lots of different places. So we can't rule out that just because it's from another country, it's not relevant. And yeah, kind of as Shelley said, coronavirus relates to all of us at the moment. So that's great. How about authoritative? What are the author's credentials? So this was written by a lady called Jackie Salo. So what are kind of her credentials? Or kind of you could talk about the New York Post if you wanted to. Did you manage to do any digging on her or the New York Post? And share in the chat.
So Shelley's saying they aren't medical professionals. And I'm saying it's not scientific, it's a journalist. So that sort of ties in with that. Got some typing going on there.
Yeah.
So Max is saying the New York Post is a newspaper for sports, business and entertainment, according to Google. And Shelley's saying the paper isn't peer-reviewed, which is a good point.
Yeah.
Ties into what we were saying earlier.
Yeah. And that's kind of a good point, Maxine. So I know sometimes it's difficult to find out information about the author, so you could look more widely at the newspaper, what's their reputation, kind of that can sometimes help.
Yeah. Simon's saying that Murrens offers his comments as if he's an expert and written by him. So seems like the newspaper is using his name to make it more legit.
Yeah,
which is quite an interesting point.
That's a really good point. So yeah, I'll just kind of like summarize. So I think you're right. Jackie Salo isn't a journalist. Sorry, isn't a health professional. She is a journalist, and she's won awards for getting the most site traffic for the New York Post. So it's not necessarily to inform; it's more to kind of get site traffic. And you made some good points there about the paper not being peer-reviewed. So a peer-reviewed paper means that it's a kind of like a research paper that's been checked by other kind of like scientists or professionals in that field, whereas a non-peer-reviewed one hasn't been checked. So you can't kind of draw any conclusions or make decisions based on that information. And Simon, again, you're spot on with that, David Morrens. So he's from this National Institute of Allergy and Infectious Diseases, which sounds really impressive. And he gives this quote, and it kind of, seems to add real weight to what Jackie is trying to say. But actually, it's not backed up by any kind of links to research. So we can't take that as kind of like a definite kind of thing. So that's great. How about accurate? Does it use reliable sources correctly? And we've kind of touched on this a bit about the non-peer-reviewed article and also kind of David Morrens. But did anybody have anything else to add about kind of like, is it accurate? Does it use reliable sources correctly?
Yeah, Simon's just saying he wouldn't trust it. Shelley's says maybe.
Yeah, that's evolving.
Evolving, yeah.
Yeah, so it's not it will, it's it might, perhaps.
Yeah. Evolving, yeah. Yeah, and Maxine's saying it says, suggesting it is more contagious.
Yeah.
And Megan says, sounds like it's trying to scare people in the language that's used, which is quite interesting.
Yeah, definitely. And that kind of fits in with what, yeah, Shelley and Maxine were saying. It's like, it might be doing this, it might be, or this might happen, that might happen.
Yes. Maxine says, and words like it appeared to have adapted better, fear-mongering words.
Yeah. So yeah, we're kind of moving into purpose now. So if you want, feel free to kind of like share if you've got any more to add about kind of like what's the purpose. And I think we have kind of like realised it's definitely trying to scaremonger. Something that other people have said in terms of does it use accurate sources or does it use reliable sources correctly is that it doesn't link to the paper, it links to a Washington Post article. So yeah, it's not linking to the actual research paper that it's supposedly based on, it's just linking to a news article. And
Simon's making the point that different views may have a political agenda.
Yeah. So some papers are kind of anti-government, anti-mask.
And Max is saying it's making people question the advice given by the professionals to control the virus.
Yeah. So casting doubt over those kind of like experts. And again, that's kind of like a form of scaremongering as well.
Yeah.
Cool. Oh, I can see another comment.
Yep, another comment coming in. Yeah, Simon's saying this causes confusion, which isn't good.
Yeah, and that can be really damaging to kind of what we're trying to achieve. Cool. So thank you very much for that. So you can sit back and relax now, and I think you really kind of like got your teeth into that article, and it was nice to see that at the start. Kind of like sometimes it sounded like, oh, it might be kind of current, or yeah, it might sound like it was from an authoritative source like that David Moran's, but actually we unpicked it and decided that yeah, it's not a great article, and it probably shouldn't be kind of circulated. So you can sit back now. Whilst I share a second checklist. So this checklist is called the Share Checklist, and it was created by the UK government to combat the sharing of misleading news and kind of false information. And it's another acronym, and it asks you to look for slightly different things to the CRAP test, which is why we've included it. So SHARE stands for source, headline, analyse, retouched and error. And I've got some questions to explore those kind of in a bit more detail. So with source, is it written by a trusted source with a reputation for accuracy? If it's from kind of a tip is if it's from an unfamiliar organisation, you could look in their about section to see kind of like, and that can sometimes give you a clue as to whether they might be a reliable source or not. If it's somebody on Facebook, or if they've got kind of like a Twitter account, look it up, have a little snoop around, see what else they've been saying, and that can help you work out sometimes like political biases, which can be helpful. So with the headline, always read beyond the headline, and read to the end of the story before you share it. And if it sounds too good to be true, it probably is. With analyze, make sure you check the facts. And if you can, use a fact checker. So the kind of example text that we're using in the next activity is a Facebook post. And when information is shared kind of via Facebook and even via WhatsApp and social media, it often doesn't have a link to the original research, and that can make it really difficult to check the accuracy of it. So that's where fact checkers can be really useful. So we're going to share a few links in a bit to some fact checkers that I use on a regular basis. And what they tend to do is they check the themes that are coming through of claims that are being made, particularly about coronavirus. So you might not be able to find the exact post that you got sent, but you might be able to find kind of like a similar claim, and you can kind of like see what the accuracy of that claim is. With Retouched, do the pictures look like they've been retouched or edited? Sometimes articles or posts can use genuine pictures or footage, but it can be taken out of context. So an example of this is a few years ago, there were videos of supposed Ramadan riots shared via social media, but the videos were actually of Swiss football hooligans, so they were taken kind of completely out of context. And with error, look for things like typos or bad grammar, lookalike URLs, or even kind of overuse of emojis. So official guidance about coronavirus in particular will always be kind of carefully checked for grammar before being kind of like posted and shared. So again, what I'm going to do is I'm just going to kind of demonstrate applying the share checklist to some coronavirus information. This is a Facebook post, and I'm going to skip to headline first. So read beyond the headline and read kind of like to the end before you think about sharing it. So I'll just read this post out. So this post is by Melissa Tate, and she talks about mask mouth, a new medical condition caused by wearing masks all day. The bacteria in your mouth, along with the dampness, causes the skin around your mouth to break out in hives, not to mention the oxygen deficiency due to the fact that you're breathing in your own carbon dioxide. There is so much bacteria, yeast, virus and fungus that lives in the mouth that is expelled as you breathe, but it is trapped around your mouth when wearing a mask all day. That, along with the moisture from your breath, creates the dampness that bacteria and fungus thrive in. It's basically like wearing a soiled diaper all day. Wow. You'll get a diaper rash. Other mask mouth symptoms include tooth decay, bad breath and gum inflammation. Hashtag masks, hashtag mask off, hashtag mask up and hashtag no mask. Cool, wow. So let's go back to the top of the share checklist and I'll just have a look through. So source, is it written by a trusted source? So Melissa Tate, I kind of found her Facebook page and had a look, and she's just kind of an average person off the street. She's not kind of a medical professional, so I definitely kind of treat what she's saying with caution. Headline, we've just done, so I've read to the end of the post and I'm kind of thinking about whether I should share it or not before I do. So analyze. Make sure you check the facts. So this is one of those posts that's making some really bold claims, but doesn't kind of provide any links to research. So I went and checked this on Health Feedback, which is a fact checker. And they kind of medical professionals and health experts looked through this post, and they said that kind of wearing masks for a prolonged period of time can cause discomfort and irritation to the skin. But there's kind of no evidence that they cause kind of bacterial overgrowth or infections. They consulted kind of dermatologists, and they said that kind of there'd been no kind of increase in risk of bacterial or fungal infection, or they'd not seen these new cases of these kind of like skin diseases. And they checked with dentists as well, and they said kind of like the same thing. They'd not seen any kind of like increase in infections during the pandemic. And they also kind of said, well, if you think about kind of in surgery, surgeons have to wear masks for operations that can last kind of 8, 10, 12 hours at a time. And there's been no reportings of kind of this mask mouth condition in those. So how about Retouched? In the bottom right hand corner of this picture, there's a little square that says News Wars. And that kind of suggests to me that the picture might have been taken from somewhere else, maybe a kind of provocative news site that's kind of less about informing people and more about kind of generating some sort of kind of like debate or provoking people. And then errors, is there any bad grammar? So I slipped up a bit. So there was mask mouth, a new medical condition caused by wearing a mask. So that should be mask. All day. The bacteria in your mouth, you're spelt YR, so kind of like shortening it, a bit more informal. And then there was expelled as you breath rather than breathe. So we've got a few errors there, a few kind of use of emojis. And it's kind of written in quite an informal way. So kind of would I share this? I don't think I would. I don't think this is kind of very high quality health information. So before I set you off on the second activity, does anybody have any questions? No, I think we're okay. So, oh.
I think Simon. Yeah, Simon was saying no.
Yeah, no, that's great. Cool. So I'm going to set you off on the second activity now. So in the PDF that was sent round, I'd like you to now have a look at Article 2. Which is a Facebook post, and Caroline has just posted a link to it in the chat if you'd like to look at it online. So Article 2 is a Facebook post by a lady called Amanda Louise, who says Bill Gates explains that the COVID vaccine will use experimental technology and permanently alter your DNA. So what I'd like you to do is kind of have a read through that Facebook post. And have a go at applying the share checklist to it this time. So we'll have kind of like another 10 minutes for this. So kind of have a read, have a go at applying the share checklist. This is one of those Facebook posts that's making some really big claims, but doesn't provide any links to kind of where it's making those claims. So for Analyze, if you have time this 10 minutes, I'd recommend kind of using one of the fact checkers. And Caroline will post links to the fact checkers in the chat. So as I said, you might not be able to find this exact post, but kind of have a look at kind of either of the fact checkers and look for things like do the vaccines alter your DNA? Cool. So let's come back at 10 past, so 11:10. And then again, we'll kind of share our responses in the chat. And me and Caroline will be available if you've got kind of any questions in the meantime. So let's take a look at this Facebook post by Amanda Louise and have a look at what we thought. So let's get straight in and have a think about source. So is it written by a trusted source? What do we think of kind of Amanda Louise? And feel free to share in the chat. Or if you want, you could talk about the sources she used, Bill Gates, John Rappaport.
Lauren's saying, no, I don't think she's a medical professional.
Mm.
And Shelley's saying, no, she's not a health professional. So along the same lines there.
Mm-hmm.
I think we've got some more typing happening there.
Yeah.
Maxine's saying her profile picture is just of her and her children. That's quite an interesting point. And then Simon's saying, straight away, I'd be cautious about this information as it's on social media. And then Shelley's saying she's just commentating via a Facebook post.
Mm-hmm.
And then Megan's saying, I don't think she's a trusted source.
Yeah. So yeah, Amanda Louise isn't kind of like a health professional. You can kind of, I don't know if you managed to, but I think I might have looked her up through Facebook, but I had a look, and she's kind of on her profile, she's been reported for sharing misinformation by Facebook. So that's kind of definitely an alarm bell as well. Yeah, so a good tip is kind of like, if you can, look up that person's kind of like Facebook profile and kind of see if they've been reported or kind of if they have any political biases. I think she's kind of potentially, and I think she's kind of like anti-vaccine or kind of had posts kind of about that. I can see Simon's typing, so I'll just wait before I move on. Yeah, Simon's kind of said emoji. Sorry, Caroline.
I was just going to say emojis at the beginning of a post. Sorry, Lorna.
Oh, it's fine. It's me.
Jumping in then.
Yeah. Yeah. So yeah, she's got like the emojis at the beginning of her post, and that's kind of maybe comes. So is that for headline, Simon, or like just general comment? Yeah, general comment. Yeah, cool. Sometimes it fits into like the error, so emojis can kind of like come under the mistakes, typos. Kind of, she does use a lot of emojis, which kind of, and it's the little exclamation mark, which makes it seem really alarming, like we were kind of finding with the news article from before. Yeah. So yeah, lots of exclamation marks there. With headline, so sometimes things don't particularly have a headline, particularly if somebody's kind of shared a video with you over WhatsApp. With this one, sometimes that kind of caption above the picture, Bill Gates explains the vaccine will use experimental technology, that could potentially be classed as a headline. But the main point is kind of like to read to the end and have a think about it kind of before you share it, and also be aware that what's in the headline can be different to the content. Yeah, so she shares a quote from Bill Gates, but she also shares quite a lot of information from somebody completely different called John Rappaport. So yeah, the headline's different to the content that she copies. How about analyze? Do we think this is accurate? Did we manage to use a fact checker to check about kind of vaccines altering your DNA? Feel free to share in the chat. Don't worry if you didn't have time.
Yeah, Lauren's saying full fact when asked, does COVID alter DNA? So she's posted a link there saying that these don't alter your DNA. And that's from Full Fact.
Yeah.
Simon's saying inaccurate on health feedback.
Yeah, cool. So I'm glad that you managed to like look through the fact checkers. They can save a lot of time, and they are really good for kind of like those posts where they don't kind of like have a link. Simon, you've managed to find this one on health feedback, but I'm glad that kind of like Maxine and Lauren, you've managed to find something similar on Full Fact. I don't think Full Fact looks at this particular Facebook post, but it definitely looks at that kind of claim. So that when kind of if you recommend kind of like Full Fact or health feedback to people, kind of just emphasize it. You won't necessarily find the exact Facebook post on there, but you can generally find the claim. And another good kind of like tip is particularly with Full Fact, they do kind of let you kind of give them kind of like WhatsApp messages or Facebook posts, and they do offer to check them for you. I don't know the time frame, but if your kind of claim hasn't been checked, they can look into it.
Simon's just saying it's pretty easy to find, just typed in RNA vaccine in the search box.
Cool, that's good.
Oh, yeah.
And they do kind of all the heavy lifting of checking the claims.
Yeah, Maxine's saying Full Fact did mention a Facebook post claim.
Okay, cool. So it could have been this one. Cool, that's great. I'm glad you managed to kind of like use Full Fact. Let's have a look at Retouched. So does this picture look kind of like retouched or edited in any way?
Simon's saying yes, no source, etc. Only the date.
Yeah.
I think Megan's typing there as well. Megan's saying it looks a bit sinister. Doesn't remind me of having my COVID vaccine, as that was a friendly experience. And then Shelley's also saying looks weird how they're holding the syringe, which is a good point.
Yeah. So some people have said you don't flick the pointy end of the needle. And yeah, people have said in the past it looks like a really scary picture of a needle, basically, yeah, aiming to scare you, rather than showing an accurate picture of a COVID vaccine needle. I can see Shelley's typing.
Yeah. Simon's making the point that syringe looks huge.
Yeah. And some people have said as well, like it could be a vet about to give an injection to an animal. We don't know, what that needle is being used for. Cool. And how about error? Were there any kind of like typos or bad grammar? Anything about the way it was written?
Maxine's saying it's all in capitals as if it's shouting at you.
Yeah. And Shelley's kind of mentioned that as well. And Simon said earlier about the emojis.
Capitals.
Yeah, kind of making it alarming. Yeah, so it's kind of like more informal. I don't think you'd get emojis on official scientific guidance. So yeah, thank you for that and for all your comments. And I think the last point that I wanted to say before I move on is that kind of like you don't have to use these two in kind of like isolation. There are some things that appear on the CRAP test that don't appear on the share checklist. So we didn't check whether it was current, and that date, May the 15th, is quite a while ago. And we were kind of also like verging on talking about the purpose. So the capitals looking like it was shouting at you. So don't feel you have to kind of like use them in isolation. You can use them both together, pick and choose which bits you look at. But also if you've got a favourite that you like to recommend, that's absolutely fine to go with that. You guys can sit back now. I'm not going to ask you to do any more. So I just wanted to share one final checklist with you, and we're not going to use this to check information today. But this is a checklist that we have developed as a service, and it's the www.checklist. And I wanted to highlight it because we've made it into a video, and some people might respond better to kind of a short video than to kind of a written checklist that they have to follow. So it's just over 2 minutes long, so it's very short and could be shared via WhatsApp or Facebook. And again, it's an acronym. So www. Stands for who, when, where, and stop. And again, I've got some more questions to explore that. So we've got who wrote it and why are they writing it. With when, think about when it was published and is it reviewed regularly. With where, think about what type of website it's on. Is it on an NHS website? In that case, the website should end in .nhs.uk. If it's a government one, it should end in .gov.uk. And if it's an academic one, it'll end in .ac.uk. And then finally stop and think before you follow the advice. And if it's too good to be true, it probably is. So finally, I just wanted to acknowledge that we have had the time today to kind of look through information and check it and have a think about it, but we don't always have that time. So what I've put together now is a couple of lists of kind of top 5 go-to sites that you could go to for coronavirus or health information, where you could know that the information on there was kind of high quality and you wouldn't necessarily need to check it. So we'll start with coronavirus information. So number 1, no surprises, is the NHS website, which is updated on a really regular basis as our understanding of the virus changes. Number 2 is the Public Health England website. So that includes health information, but it also includes information on legislation. So like how many people you can visit indoors or outdoors at once, where we are in terms of lockdown. Number 3 is the World Health Organization. So this has a myth busting page which can be useful to visit, but just be mindful that it's kind of got a global perspective. So it might not kind of take into consideration specific kind of UK guidance. Number 4 is like the National NHS Library and Knowledge Services website. So this has kind of really great resources in lots of different themes. So information in accessible formats, so some in British Sign Language, for example, and some aimed at different audiences, so children, older people, or on specific topics like mental health. And number 5 is the Greater Manchester Mental Health website, which has information about coronavirus, but also about kind of how to support your mental health and that of others. So misinformation doesn't just happen during pandemics and the time of COVID. It can happen kind of at any time. So we're sharing with you kind of trusted sources of general health information as well. So number 1 was one of your top sources as well, which was the NHS website. So that's kind of our go-to source for information on health and medicines. Number 2 is Patient, which was also mentioned by you guys. And this has got kind of information on conditions, but also blogs. And those blogs are actually checked by health professionals. So they're written kind of by journalists often, but checked by health professionals. And you can see kind of who's checked what, which is really good. Number 3 is Health Talk. So this has information on different health conditions, and it's developed by clinicians and service users. And the thing that I really like about it is that it's got a lot of videos of service users kind of talking about their experiences, which can be really helpful. Number 4 is Medlineplus. So again, that has information on different health topics, but a kind of real good thing about it is that it's got links to information in different languages. So one thing to highlight about it is that it's an American website. So if you were kind of looking at information on medicines on it, the names would be different because the American brand names are different. So I wouldn't signpost to it for kind of information about medicines, but if you're looking for information in different languages, that's a good place to go to. And number 5 is Easy Health. So this is easy read information, which is produced by different NHS trusts, and it's great for kind of people with learning disabilities. And they tend to have kind of dates on the bottom to say when they were last reviewed, so you can check how up to date the information is. So give yourselves a pat on the back. You're now all knowledge champions. So what that means is just a reminder kind of to use your learning from the session today in your own practice. Lauren's celebrating, yay! Please share your learning from the session today with others, so share the checklists, share these top sites if you want to, or kind of like the links to full fact and health feedback. And also feel free to kind of stay in touch with us and ask us more about this if you want to. So I usually ask if you could let us know how the training went. We'd be really interested to know kind of how and if this training has helped you in the future. So you can do this by emailing us. Our email address is library@gmmh.nhs.uk, but we also have a feedback survey. So Caroline's posting a link in the chat now, and the last question in that survey is if you'd be happy to be contacted about the impact of this training, please leave your email address, and that's kind of what that question is about.
Some feedback from Simon there, just saying thank you both. The fact checker health websites are really useful. That's good to know.
Cool, I'm glad. Hopefully, like the fact checker ones will save you a lot of time. Yeah, and also kind of like the top 5 health websites. So that's it from me. I've got a thank you and any questions. Before I get to that, I'll just say this training was developed with support from Public Health England, Health Education England, the Patient Information Forum, Manchester Health and Care Commissioning, and Greater Manchester Mental Health NHS Foundation Trust.